Conditions. What exactly does that mean? Often we hear about the mortality rate associated with COVID-19, and it is followed by the wording underlying conditions. In previous El Paso Physician programs here on PBS El Paso, we have focused specifically on that question when it comes to COVID-19. The dangerous answer to that is two conditions: obesity and diabetes. Those are the two main underlying conditions that we have that really worsen your chances of getting better or surviving of COVID-19. According to the CDC, Texas has one of the highest rates of obesity in the nation, and additionally, Hispanics, which El Paso is about 80% of, have the highest age-adjusted occurrence of obesity. Obesity can seriously harm your health and can increase the risk for numerous health conditions such as stroke, heart disease, diabetes, among others, and specifically right now in this day and age, COVID-19. If traditional diet and exercise has not helped up to this point, then we are looking at bariatric surgery. That is this evening's topic. During this hour, we've got experts addressing concerns about obesity and the medical consequences, as well as discussing some steps that can help you put you on a healthier way of life, and again, get yourself a little bit more help when fighting other issues that you've got going on in your lifetime. This is a live program, as you already know. So think of some questions of your own you'd like to call and ask us about. The telephone number to call is 881-0013. We are also streaming live on YouTube. You can enter PBS El Paso, Public Broadcasting System, so PBS El Paso, into that line on YouTube. This evening's program is underwritten by the Hospitals of the Hospitals of Providence, which has a lot of progress. We also want to thank the Texas Tech Paulo Foster School of Medicine and their medical students for providing medical students and just help in general to man our phones and get the questions our way. And as always, the El Paso County Medical Society for bringing this program to you each and every month. I'm Catherine Berg, and you're watching the El Paso Physician. Thanks again for joining us. We're going to talk about some of the underlying conditions that we talk about often when you hear about mortality rates with COVID-19. With us this evening is Dr. Michael Lara, who is the co-medical director and fellowship-trained bariatric surgeon. He's been on the show several times in the past, and we welcome you back. Thank you for being here. And we also have Becky Ariano, who is the program manager of the Hospitals of Providence. Calling it Progress, the Hospitals of Providence Weight Loss Center. And so Becky is going to be the person that kind of talks us through when people are interested and wondering if they qualify, etc. So with those two disciplines, Dr. Lara, I know you've been here several times in the past, and I know that we, again, are very specifically looking at COVID issues right now. Obesity is a problem. It's a major problem. And as we were saying earlier, that Texas is one of the highest rates of obesity in the nation. And we have a lot of Hispanics here. We have a lot of diabetes here in El Paso. So if I can have you explain to the audience what you do all day, every day, and maybe bring into COVID-19 of how your outlook and your perspective of people with obesity has changed quite a bit during this time.
So I'm a general surgeon. I've been here in El Paso over 20 years. And so I perform, I guess my week is split. Half of it is general surgery, gallbladders, hernias, colon cancer, some breast cancer. And then the other half of it is bariatric surgeries. Mm-hmm. And right now I'm only performing the Roux-en-Y gastric bypass and the sleeve gastrectomy.
Okay.
So,
and both of which we have videos
right
this evening. So tell me again which two we have again. We've got the gastric bypass.
The Roux-en-Y gastric bypass and the sleeve gastrectomy.
Okay. And we'll talk about a little bit this evening as well.
And so I guess you were asking me what's changed in this past year.
Right.
Well, initially what I was seeing is people, when there was a complete shutdown, both in the hospital and in the clinic setting, people were just afraid to come, period. Mm-hmm. And it caught us also by surprise. Who knew that we was going to last this long? But then we adapted. Telemedicine, Zoom seminars, etc. Mm-hmm. And as this pandemic has progressed, now I'm seeing the patients, seeing their relatives, hearing the public announcements, and seeing the effect or the possibility of them contracting COVID. And if they are overweight and have hypertension, sleep apnea, high cholesterol, diabetes, now they're looking for us. And,
Right.
And so that's a change I've seen. Initially, it was stay home, shut down, and now them reaching out to us and saying, hey, I saw what happened to my neighbor. I saw what happened to my dad, and I don't want to go that route, and so I want to get this thing before I catch that. And I know that, as you well know, being obese increases the severity of the illness if you do contract it. And also, I think that they say triple the likelihood that if you do get it, you're going to end up hospitalized.
Exactly. And I usually at this point would pivot and ask Becky some questions or have her introduce you, but I feel like this segue is so vitally important. So being obese, and I know that there's being overweight, mildly obese, obese, morbidly obese, and we don't need to get into that right now, but what is it that is the issue with being obese and not being able to be to get out of COVID as easily as others? Let's be specific on what we're talking about.
I guess first we need to realize that obesity is a disease. If you realize that in and of itself, then okay, that's the first step. And so a lot of obese patients, and what people don't realize is that they're walking around like in an inflammatory state.
Yes.
So if you're walking around in an inflammatory state, then all that is going to lead to a lot of them then are walking around with a compromised immune system. And so if you get COVID, then the likelihood of you being able to mount the immune response is a lot different than if you were not obese. And then we know that being obese puts you now at high risk as all those comorbids that we talked about, diabetes, the sleep apnea, hypertension, and now
your body has to work that much harder against the...
And so the mortality goes up significantly.
Right. I wanted to give a shout out really quick to our medical student. And Ryan, I apologize I didn't introduce you at the beginning of the show, but if you all have some questions that you'd like to call in and ask us with this evening, it is a live program, and Ryan Fonseca from the Texas Tech Paulo Foster School of Medicine, who's in his first year, and this is his first time here, but he will be taking the phone calls and then passing the questions on my way. So that is, I just want to introduce you to Ryan really quick. On that note, Becky, as the program manager for the Weight Loss Center at Hospitals of Providence, this is where, and I know Dr. Lara talked a little bit about it, but there's always that question of when is being overweight too overweight to go on and live a healthy life. And so what I'd like for you to do is talk about what you do all day, every day. And you're often, I'd imagine, the front line of people calling in saying, well, how does this work? How do I know? Am I just a little overweight? Am I morbidly obese? Am I mildly obese? Talk about that a little bit.
Right. So what I do all day, every day is exactly that. So my responsibility is to help those patients answer their questions, to let them know if they are a candidate and the steps they need to take, so that so Dr. Lara can see them there at the office. And not only that, but get them approved for the surgery, which is, the biggest thing, because a lot of people, they're scared. They think that their insurance doesn't cover.
Right.
And
so here's the ugly question, and I usually don't like to talk about insurance on this program, but this is a big one, because this really is a situation and how you qualify for insurance to help out or not. And again, I know that you deal with those questions. Sometimes it's like, oh man, I'm like 5 pounds more, but does somebody try to gain 5 pounds so they can qualify, etc. We're going to get back to the different, because I do want to talk about BMI, I want to talk about IBW, etc. But what is it that people, when they telephone the center, what is it that they're looking for to give to their insurance companies, or what are insurance companies asking for? Maybe that's the better way of asking the questions. What are insurance companies asking for?
So every insurance is different, of course. So it's a matter of me checking their criteria and reading the clinical policy. So they want to make sure that they are a candidate with a BMI of either 35 or greater with a comorbid condition. And the comorbid conditions that count are high blood pressure, sleep apnea, or diabetes. And then also there's some insurances that you just need a BMI of 40 without having one of those conditions. So I do screen the calls. I, ask what, or figure out what their BMI is so that, I can check to see if it's going to be a covered benefit with their insurance.
And so just for the audience, BMI, and I know we have mass on, but it's body mass index. And you can go to almost any search engine and find out how to calculate that. But since we're here on the air right now, let's talk to the audience how they can calculate their body mass index. And why is that so important when we're looking at insurances? And in just a moment, we'll talk about IBW as well. So for your BMI girl, he'll be IBW guy. How's that sound?
Okay. So the BMI is really easy to calculate. All you need is your weight, okay? And then you multiply it. This is what I do, times 703. And then you divide that by inches. So if you're 5'6", it's 66 inches. And then times 2. And that's how you get your BMI.
Okay, and if you can't remember that, that's good, because we can't remember it either. Again, you can go to any search engine, put in BMI, body mass index, and it will give you a little calculator of how you can figure out what your body mass index is. Dr. Lara, let's talk about now the difference between body mass index, and then there is IBW, which is, say it again, ideal body weight. So that includes now the age, the sex of the person, height, etc. So talk a little bit about that, because BMI, again, you can find that on the web. You can get to it there, but IBW might be a little bit more difficult to calculate.
So BMI is important because it's with the National Institute of Health, and then they came up with this criteria, and then the insurances followed suit. And so you have to meet by criteria those BMI numbers that she just went over.
Okay.
35 to 40 with a comorbid, or greater than 40, and just in and of itself, that'll qualify you. But ideal body weight comes into play when a person is trying to get an idea as to how much weight they'll lose if they get one of these surgeries.
Okay.
So ideal body weight is those life insurance charts that were in the back of the classroom when we were growing up, and we'd look at it, and at the time we all fell into the category, but now we don't. So that's what those life insurance companies were saying you should weigh. You're a female, you're 5'4", and you should weigh this amount. That's your ideal body weight. We take what a patient is currently weighing today, subtract their ideal body weight, and that gives us how much excess weight they're carrying.
Okay.
And once we determine that number, how much excess weight they're carrying, then I can give them an idea as to what amount of weight they'll lose if they get either a sleeve or a bypass. And on average, I tell them, with a sleeve, you can lose 60 to 70% of your excess weight, and with the bypass, you can lose maybe an additional 10%, so maybe 80, almost 90% of the excess weight. And if you achieve that percentage of weight loss with either procedure, you're deemed a success, because that is comparing it to the national goal weight loss with either one of these surgeries.
And what I'd like to do is, Gracie, if you can kind of queue up, I'm going to ask Becky a question first, but if we can queue up the 2 videos that we have, because we have 2 videos that essentially shows exactly what's happening inside the body and how the weight loss surgery occurs. There's 2 different types, as you just talked about. And Becky, what I'd like to do with you, while we're queuing those videos up, is when people call the center, is there that automatic expectation of, hey, I want to have a surgery? Or is there, hey, how can I be able to lose weight? And there's traditional methods. And I guess that's what I want to talk about, is the exhaustion of traditional methods. That usually is when they start coming to the center. Is that correct? And so I'd like you to just kind of take it from there.
Yeah, that is correct. That is when that's their last straw once they call the center. So of course we just, they tell us everything that they've been through while they're successful, and then plus unsuccessful diets and all that, which is really important for insurances too, because once we generate a letter of medical necessity, we do put their failed attempts, which is important as well. But yeah, that is, where they've already tried everything, and a lot of the times they know that this is going to be their new life.
So here's that, again, odd question, but very important. When people are addressing an insurance company and you say they've tried everything, what is it that they have to prove that they have tried? And I'm asking only because that's the big question on the table, right? It's like,
Right.
well, I've tried a couple of diets, whatever. Do they have to prove within a certain number of years? Does it have to be a certain number of doctor visits? How is it that they calculate that?
And yes, and it depends on every insurance, exactly what you said.
You're right. Every insurance is a little bit different,
So
right?
some of them do require for them to do a weight management program where they need to go on a monthly basis to see the dietitian to discuss diet, weight, and exercise, because we need to prove to them that they're going to be compliant with what is required of them. And then there's some insurances that don't even require that. However, they require for us to let them know, okay, what are the diets that they've done in the past and how successful and unsuccessful were they.
Okay.
So we, put that in writing for them to let them know that the patients have failed in the past.
Okay. And here's my next question. And I think to myself, okay, if I'm an insurance company owner right now, it would behoove me to help somebody lose weight, because then all the comorbidities that we were talking about, then there would be less chances of them having complications with other issues.
Right.
Before we go into, because we've got the sleeve video lined up, but before we go into that, what are some of the other complications that can be alleviated when people are able to lose a significant amount of weight?
The resolution of the diabetes, their sleeping pattern, the sleep apnea gets resolved, their high blood pressure, it just changes their whole entire life.
And we're talking about heart issues, cardiology, all that
Yes.
good stuff. And I'd like you to kind of keep that on the tip of your tongue, so to speak, because we're going to talk a little bit more about that in a moment. And before we go to this video, I wanted to bring this out several times during the show. For those of you that are interested in getting the COVID vaccine, and I hope everyone is interested in getting the COVID vaccine. I got the guys like, So there's some new information that I have here for you to register for the vaccine. EP for El Paso, covidvaccine.com. So that's a place that you can go to. I just received that information from Patsy Slaughter, who's the executive director of the El Paso County Medical Society. She sent that over my way today, that is new information and a new website that you can go to. You can still always go to elpasostrong.org. However, the new website that you can go and register to is epcovidvaccine.com. If you're not really great with the computer, here's a telephone number that you can call too. Yes, there are going to be some hold times, so be expecting that. A telephone number, 915-212-6843. I'll repeat that, and I'll do it several times throughout the program. 915-212-6843. And we do have that on the screen. Thank you very much for putting that up there. So the video that we have here, and Dr. Lara, I'd love for you to explain. So this is the sleeve that we were talking about earlier of one of the two popular procedures that are in bariatrics right now. So whenever we can cue that up and get that going, I'll have Dr. Lara just kind of walk through it. Here we go.
Okay, so I'm gonna do this with laparoscopy. Those are trocars, or small tubes through which put the camera. All right, there's 6 for the bypass and 6 for the sleeve, and these are gonna be where we put our instruments through. One for my right hand, one for my left hand. The middle one by the belly button for the camera, and then right and left hand on the opposite side of the belly for the assistant. This is showing normal flow of liquids in an adult stomach. An adult will usually be able to fit about 2 to 3 liters of fluid in a stomach. And you can see after it goes to the stomach, it goes down the small intestine. What I'm going to do is decrease their stomach size by about 85%. And that piece of stomach that is cut off there to the right is removed. There's not an in, there's not an out, there's not a blood supply, it's cut. And so it needs to come out. And then the patient is left with a more narrow, longitudinal, sleeve-shaped stomach. And that's going to send signals that they're less hungry, they're not going to be able to eat as much, and they're going to feel full with smaller portions, thus achieving early satiety. And all those things are what lead to weight loss.
Okay. And so when you say that rest of the stomach needs to come out, that's all done through just literally pulled through the whole. It's fascinating to me, and I know that you described this at one time several years ago, but how is it that the rest of the tissue is taken out?
Because those patients come in and they've been empty, nothing by mouth, for since the midnight, the night prior. And then we also suction things out. And so it's pretty pliable. And yeah, you're right, it's gonna take some stretching, but it's still through a very small incision, about the size of your thumb,
Right.
and we're able to get it out.
And that's why I wanted to bring it up, because there's not a whole extra, cut or incision made. It is all done through the holes that we have there too. We'll queue up the gastric bypass, but what I'd like to do with Becky is there's a lot of preparation prior to having either one of these surgeries with the patients, correct?
Right.
So once someone is qualified by the insurance, or again, there's a pay as you go situation too in case insurance does not cover it. So that is also an option. You know what? Let's talk about that really quick, because otherwise I'll forget, and the show will be over. I'm like, ugh. So if insurance doesn't cover it, that's something. If I can have you just address that really quickly.
Okay, so if the insurance doesn't cover it, there's some options that we do have available. Number one, we do have a lending company that we can provide the phone number to the patients to, so they can possibly get a loan. Number two, we are working on a payment plan option. It's not established yet, but we are working on that. So that's going to help a lot of our patients as well.
Okay.
I do recommend people also sometimes when they don't have the benefit, their 401k sometimes is really good in giving out loans, and you just pay it back to yourself. A lot of things can work.
A lot of things can work. So what I'm going to ask now is, prior to going to the gastric bypass, is when someone is preparing for surgery, how long usually do they prepare for? Is it a couple of weeks? Is it a couple of months? Are there certain things that you're asking them to prepare their bodies for? Because obviously there's going to be different behavioral habits that they should adopt once either one of these surgeries are done. So what is it that they usually have to prepare for? Is it a change in diet? Is it exercise, et cetera, et cetera?
So it could be a change in diet depending on Dr. Lara's evaluation. But mostly it's always insurance what they need to prepare for. It's either going to be right away, or it's going to be 2 to 3 months, or sometimes 6 to 7 months, and then that's about the process. And again, it depends on the insurance.
Okay, so
So
let's talk about medically.
She's referring to the fact that there's some insurance going to make them wait those 3 months of documented attempts at conventional weight loss.
Okay.
But from my part, it's just if a patient's BMI is extremely high, and I know that inside is going to be a difficult surgery with more complications, higher chances of a wound infection, then I may have them lose some weight beforehand. And
Okay.
then in that case, they work with a dietitian, start working on the caloric intake, the carbs. And then, yes, something that I was going to mention earlier, obese patients on average have decreased pulmonary function, and so less reserve. And what I
Right.
always tell them is, because they tell me, doctor, let's just hope that you're on that day and that everything goes well and get a good night's sleep. And I tell them, you know what you got to do? You got to start walking now, because you can't just come from the lazy boy to the operating room. You're going to struggle. And, so because it's under general anesthesia, and so I tell them, just start walking.
Right.
Get a pedometer, get a fitness tracker, get a smartwatch, and just utilizing those has shown that anybody who uses those will increase their walking about an extra mile a day. So try to get into 10,000 steps, and that'll help.
And that's exactly what I was looking for, and that goes with almost any surgery, but specifically here too, that you want to get as in good shape as possible prior to the surgery, so that the recovery from the surgery is that much better. Because there will be, again, with the sleeve and gastric bypass, there are going to be different issues that they will have afterwards, and not issues, that's the wrong word.
Right, but they could.
But there would be different vitamins.
You always got a wound infection, pneumonia, a UTI, a blood clot, and all of those are related to, a lot of them are inactivity, not getting up and getting out. So that's why doing it minimally invasive is not that painful. Thus, if you don't, I tell the patient, if you're not having pain, you're gonna be ringing that cowbell to tell the nurse, help me get out of bed and let's walk.
Right.
As opposed to if you have a lot of pain, the way they used to do this with a big incision, what was the nurse gonna give you? Morphine? And then that patient now is conked out, doesn't wanna get out of bed, and as soon
Right.
as they do, they're hurting. So laparoscopy is what changed this game. And that's what's ultimately led to, decreased complications and, a faster recovery, return to work, et cetera.
Right. And there is too, and I'd love to talk about this, there is an absolute commitment that the patient has to have after the surgery. And since we've already looked at the sleeve, and I think that's with both of the surgeries, what kind of a commitment are you looking for, Becky and your team looking for? What kind of a commitment from the patient are you looking for going forward after the surgery?
Yeah, it's funny you ask that because I have a contract. It's a carbon copy. They keep one and I keep one. And I sit there with them and I go over the steps, what I need them to commit to.
Okay.
And number one is follow-up. I have to see you in follow-up.
Okay.
Because if I don't see you, I don't know whether or not you're taking the right amount of protein in, whether or not you're drinking the right amount of water, whether or not you're doing the vitamins, the minerals, the supplements. Are you losing weight? Enough? Not enough? Too much? So they got to commit to that. And once they commit to that and they come see me in the follow-up clinic, they're going to get an evaluation by the nurse and by the dietitian. So there's 3 people that are going to see them on every follow-up visit. And they're willing to do that.
And how often do they follow up? Is it instrumental? Like, for example, is it the first? Okay.
It's at 2 weeks, at 3 months, 6 months, a year and a half, and thereafter every year.
Okay.
And it's forever.
Okay. And it's forever. And I like that because
we
that
are,
matters.
This is the only, and there's some orthopedic procedures that are monitored by governing bodies. And ours is, it's MBSAQIP. And they come around.
Say that slowly? Dear Lord.
MBSAQIP.
Okay.
But we need, most programs, or if you want to be a legitimate bariatric program, you need to obtain credentialing by this governing
Right.
body. And they come around every 2 years and they look at what we're doing and how we're doing it, our complication rate, our follow-up rate, et cetera. So that's why I tell the patient, you have to commit to me because what we do affects everyone.
Affects you guys.
Yeah, affects us, it affects
Right.
the hospital, and affects future patients.
Absolutely. We're getting a ton of questions here from the audience. Ryan, thank you. You're doing an awesome job. What I'd like to do before we get into these, I would like to show the video now, if we could. And this will be of the gastric bypass surgery. And again, Dr. Lada is going to walk us through that as that is shown up there.
Okay, so again, 6 small incisions, and those are about the size of your little pinky, and middle one camera, the one on the right side of the patient for the assistant, left side of the patient, actually assistant right side for the surgeon. Come in, and in this surgery, you're gonna make a cutout using your existing stomach to create your new stomach. And your new stomach is gonna be about the size of the palm of your hand, about the size of an egg. And they're gonna come downstream, cut the small bowel, and bring it up in a candy cane-like fashion and connect it to that new little stomach. And now food will come down, hit the new little stomach, you'll see it right now, and give again the patient the feeling of fullness and decrease hunger, and then fluid will go down from there. But I think this video, oh no, there it goes. So that's just showing the reconnection downstream to get continuity. So there's the blue is the food or the liquid, and the green is your bile, gastric juices coming from your old stomach, and then they meet in that Y area and then form the common channel.
Okay.
So this one, if I can go back, the sleeve is going to work strictly by restricting the amount of
Right.
food the patient can eat.
Right.
The bypass works by restriction, and then there's also something that we call a component of malabsorption. So the patient will not absorb all the calories they eat because of the fact that we have bypassed a segment of intestine.
Exactly.
And
Okay.
that is why
This is the follow-up part
this is another
too.
reason why the bypass is more recommended for patients who are diabetics, because that's the other question that people ask. Which surgery is for me, doctor? 2 things. Type 2 diabetes, very aggressive in your family. I'm gonna lean toward a bypass. The other thing is if a patient has very bad reflux, heartburn, GERD, then also more towards bypass. Because
Right.
those two diseases are respond better to a bypass. And earlier we were talking about El Paso and how unique it is. Nationally, the sleeve is now the most common procedure.
Interesting.
But here in
Okay.
El Paso, I find myself performing about 50-50. And the reason is because the large Hispanic population and the large percentage of those patients affected by diabetes. So if I'm going to be really honest with them, and I'm going to tell them, hey, I'm doing this to make you healthier, which is the one that's going to help your diabetes more, bypass.
Right. And that's so spot on too. And Becky, I'm going to ask you from here. We were talking about what you do prior to these surgeries, but now let's talk about part of the follow-up. So there's going to be, and use the perfect word, malabsorption. So going forward, obviously you talk to the patient about all the stuff they're going to have to do afterwards, but when they come in for their follow-ups, do you find for the most part that people are again, taking on the responsibility on their own? What is it that they're going to, like you said, follow up for the rest of your life? The vitamins that they need to take, the diet, again, because if you're not able to absorb everything that you did before, what are some of the things that you let these patients know as they're finishing their surgeries?
Right. For the most part, they are pretty responsible. They do come, for their follow-up visits where Dr. Lara monitors everything. The key also here is the dietitian.
Exactly.
They come and the progression of their diet, how everything has changed, their protein needs. But for the most part, they do come for their follow-up. It is very important for them to come, and mostly all of our patients are responsible. They will come.
And so what extra vitamins are people needing to take? Is there extra vitamin D, extra calcium? What are some of the normally absorbed vitamins and minerals that are not able to be absorbed as much now?
Right. So Dr. Lara does request or prefer a certain type of bariatric vitamins that the patients can absorb.
Okay.
Versus over the counter.
Okay.
I mean, he will work with whatever's available, but we do have a list of certain recommended vitamins.
And that's going to be their B12, their calcium,
Okay.
the multivitamin, and vitamin D3.
Okay.
So just standard across the board for both surgeries.
Those are the good feel vitamins
Yes.
too. Yeah.
Yeah, so
okay.
I tell patients, especially if you're a female,
Right.
you need to be taking a multivitamin. You need to be taking calcium to help you to the chance of you getting osteoporosis.
Right.
And so really the only other thing we're throwing into the regimen is a B12 and some D3.
And D3. And every
the
now and
the B12 can be injection or sublingual.
okay. So on that note, that's a whole nother show, vitamin injections. And also, I know we're the Sun City, get outside a little bit. Vitamin D from the sun is beautiful, just make sure you...
But there's been no sun the last 3 days.
I know, and in a weird way, I kind of enjoy the rainy weather. I can't complain at all. I'm going to go here to questions from the audience, specifically from the audience. I'm just going to throw them out, whoever wants to take them. But with the current COVID-19 guidelines in hospitals, when can someone receive bariatric surgery? Great question, which is one of the reasons we're doing this program, that there are certain floors in hospitals that are very COVID related, but others that are reserved for what happens to be going on in people's lives anyway. So Dr. Lara, I'd love for you to talk about that. So I'll repeat it. With current COVID-19 guidelines in hospitals, when can someone receive bariatric surgery?
Currently right now, at all hospitals, they are open to inpatient surgeries, which is what this is referred to, because it's considered inpatient because the patient is going to be admitted. And right, like you said, there's in all hospitals there's specific units or portions of the hospital that are all COVID, and then there's floors and parts of the hospital that are non-COVID. A lot of hospitals too, everyone has to be tested prior to going through surgery, and so if there's a positive test, that patient's not going to get through those doors. And then, but right now, yes, they are allowing inpatient, and the sleeve is an overnight stay, and the bypass is 2 nights. So sleeve is 1 night, get surgery, stay the night, the next morning, after your dietary class, you're out of there, and the bypass is 2 nights, 3 days.
Okay, and explain, because you brought it up, and I love that, what is it that what everybody's looking at after? So you've got 1 night for the sleeve, 2 for a gastric bypass. What are you looking for the body to do prior to being able to go home?
That you walk, that your pain is under control, and that you're tolerating the diet. That's the number one thing. The you know, when I started doing this, what, 16, 17 years ago, the complication rates were higher. And the fear back then was blood clot, wound infection, etc. Nowadays, my number one reason for a patient readmission is dehydration. So it's a struggle with the diet. So that is why now I've shifted the pre-op teaching to emphasize how to prevent dehydration. And here at the Hospitals of Providence East, we have an IV infusion center. And so we can utilize that center for IV fluids to prevent an admission via the ER, et cetera.
Right.
And to nip this in the bud before, because dehydration is a horrible thing. I mean, if you're dehydrated, it's gonna affect, you're gonna get a headache, you're gonna be lethargic, it's gonna affect your kidneys, your pancreas, et cetera. So that is, nowadays, like I said, it's fairly safe. And as long, if you get through the early healing phase without struggling with dehydration, you'll be okay.
So without being in the infusion center, is it, I mean, it seems like it's so simple as just drinking extra water, but it's not the case.
Yet.
Exactly, right. So that's
because
my point.
Surgery can trigger nausea.
Right.
You see, yeah, so when I'm doing a seminar, I tell patients, yeah, you're probably sitting here thinking, I love to drink water, I can chug a gallon, but the problem is nausea. So people react to surgery different. And we're actually, I'm cutting the stomach,
Right.
you know, and they've undergone general anesthesia. So they may be nauseous for multiple different reasons, and if they're nauseated, they're not gonna wanna drink. So that's where they just gotta power through it, and we give them tips. You know, sometimes get the water and stick it in the microwave for a few seconds,
Right.
or try this, try that. That's where the dietitians come into play, and just try to get that in that early process. It's always, it's a transient thing, I tell them though. There's not permanent. I mean, I've never had a patient with permanent nausea.
Right, right.
So it's just, and then there's a lot of medicine.
There's a lot of changes going on
Yeah,
at that
there's a
time.
lot of
I mean,
changes.
yeah.
And then there's a
You're
lot of
upside down.
medication regimens that we can try, but again, most anti-nausea medicines cause people to feel sleepy, and so they don't like them. You know,
I
especially if
see.
you have small children, or you want to get back to work, you can't be popping the Zofran Phenergan, because then you're not going to get out of bed.
Right.
So it's balanced.
Yeah, and getting out of bed's important too, so you got to walk around and do your thing. Another question here from the audience, and this is actually a great question because this is a medical show, and they're asking about liposuction versus bariatric surgery. So it's good to talk about this because they're two very, very, very different things. On that note, I'm just going to let you handle that question any way you want to, because when you watch media or you see something in the magazine and you have billboards like, oh, liposuction, again, that's
It's all cosmetic.
It's cosmetic.
And
It's a quick
good.
fix.
And there is a role for it in certain people, but if you're trying cosmetic surgery, lipo is not going to help your diabetes, high blood pressure. You're going to look better in front of the mirror and you're going to fit into that dress. But if you want your whole body to have a positive change, your sugars to get better, your blood pressure to drop, you get off the sleep machine.
Diabetes help, everything with
It's bariatric
vascular
surgery.
issues.
Yeah, because bariatric
Okay.
surgery is just, it's a systemic weight loss.
And I like that you said that too, because we're looking at a medical procedure. Not that liposuction is, that you said it's cosmetic, and I respect that too, but this is also a behavioral change. When you're looking at bariatric surgery, these are behavioral changes that are implemented before and especially after the surgeries to help keep that weight off. With liposuction, it's just gone and then it just comes back, but
Right,
there's
and
not
then-
that
and you bring
behavioral
up a good
change.
point, because it's, if the patient buys into this as a behavioral change, you've just had a patient who's gonna succeed for the rest of their life.
Right.
But if they don't, then they're gonna struggle. If they buy into the fact that we tell them, you gotta take in this amount of protein, you gotta do these vitamins, you gotta drink the water. And when they start losing the weight, and they realize, hey, I'm no longer on insulin, hey, I'm no longer on metformin, hey, I'm no longer on high blood pressure medicine, and I no longer need that machine, and they realize how positively and how quickly that's impacted them, then they're like, I'm never gonna go back to that.
Right.
But the patient
Right.
who constantly fights that and doesn't appreciate the benefits, you're gonna lose them.
Right, exactly. Another question here from the audience, Becky, I'm going to throw this one your way. Question is, how quickly can I start losing weight? So again, you're one of the, when you're looking at the clinic and you're head of the clinic, it's like, okay, I've had my surgery a week ago. And maybe this is something that's part of the consultation prior to having surgery. So the question is, how quickly can I start losing weight on bariatric surgery, and what are the risks involved? You talked about some of the risks, but in general, that's the question from the audience.
Right. So when they come in for like their 2-week appointment, it's amazing to see that people have already lost a great amount of weight. I mean, we're talking 10 pounds to 13
Oh my
pounds
goodness.
in 2 weeks. So
Almost a pound a day.
yeah, it's almost a pound a day.
Almost
So
a pound a
it's
day.
very
Okay.
quick.
Okay.
Very quick.
And what is it that's contributing to that? And I know we talked about there's obviously less that fits into the stomach, the absorption, the vitamins, but is that, just in general, when someone's asking, well, that's a pound a day, how long does that last? So I'm just going to throw out a number. I'm going to throw out 400 pounds, just because it's an easy number to deal with, okay? So there's 400 pounds, and losing a pound a day, within a month, that's 30 less pounds. So 2 months, is that 60 less pounds? Is there a tapering down of poundage? Do you know what I know what I'm trying to ask.
Yes.
I'm getting it across. Thank you,
Yes.
Dr. Lara. Thank you very much.
So that brings us back to excess weight loss. Remember?
Yes,
so
exactly.
because that's what I told you. That's
The
what we're gonna
IBW,
use,
okay.
IBW and EWL. Right?
Okay.
So in the first 2 weeks, patient is probably going to lose about between 10 to 20% of their excess weight.
Okay.
So that's why she said 10, 13, 14, 15 pounds, because you're assuming that patient is 100 pounds overweight.
So there you
See?
go. That's the
So
point.
then
Okay.
at 6 months, the goal is for the patient to lose about 50% of the excess weight. So that 400-pound patient, I don't know what their excess weight is, but if they're carrying an extra 300 pounds, by 6 months, they should or they can lose the 150 pounds of the extra 300 they're carrying. And by the year, you're hoping they have lost 80%. And 80% is deemed a success.
Okay.
So that's where you start working with the patient. You know what? You're a little behind, or you're ahead of the game. You're doing everything good, and if the patient gets there in the first year. Patients. That's the other thing. The patient can continue to lose weight for an additional 6 months to a year, but it really starts plateauing after that.
That is my big question. So, and the plateauing is natural, because you don't want to be 0
Under
pounds
your
at the end of the
ideal
day.
body weight.
Exactly. So when you're talking about ideal body weight, so there is más y menos. We're talking about a year. Again, you've got the quick poundage that leave, and then there's a small plateau, and then going forward too. And the reason I want to say this is that I want to have realistic expectations that we're talking about, because you're going to lose a lot of weight right away, and then there's going to be a point too where your body's like, okay, well, now I'm kind of getting used to this. We're 2 months in. You're getting used to the diet. You're making sure you have a lot of fluid intake. You're getting used to making sure that all the vitamins that you need, the minerals that you need are in your body, and there's that time frame. And just over the different shows that we've had, then it goes to maybe a couple pounds a week from there, and then, or 2 or 3 pounds a week until you hit that year.
Right.
Okay.
And that's where the evaluation by the nurse and the dietitian, when they come see us at the clinic, is key, because then you focus on what is missing. If they're not hitting those points, what is it that's missing?
Right.
Is it protein? Is it lack of exercise? What is it? So that's when we can tweak it and get them back on schedule, because you can always get somebody back on track in that first year and a half.
Right.
But what I tell patients, so that's the other thing, is why in the front end of it, they gotta be 100%
Yes,
committed.
they gotta be in
Because
it.
it's a one-shot deal. I can't see a patient 3 years after the fact and be like, oh, you know what, let's go back to what you felt like the first 2 weeks after surgery. It doesn't work that way.
Right.
This is a resetting of the internal, we call it the internal thermostat, or
Right.
whatever you wanna call it. And
It's the
a-
behavioral
and
change,
it's a
and that's
one-shot
something I
deal.
want to talk about a lot too. So the behavioral change, you got to be in it to win it, and I think, depending on different studies that you read, like with COVID, it takes about 30 days to create a new habit, like 30 days of doing the exact same thing to create that habit, and then 60 days, and it's like quitting smoking, it's like everything else. And then when you have that under your belt, you start getting to that point. I have to ask this because it's a question from the audience, and it used to be something we talked about years ago. Lap band surgery, is that just something that's not happening at all
Not
anymore?
happening anymore, just
Okay.
too much reflux leading to esophagitis, mega esophagus, So, and I was taking it, I think the last time we were here, we talked about it, but
We
because
did a
of
little
the
bit.
amount that I was removing. But now there's very few people out there with this band still in place. I haven't removed a band, well, I haven't placed a band in years, and I haven't
Okay.
removed a band maybe in about 18 months.
Okay. And so on that same note, because we're about at the point where I'm just going to start asking you what questions you want to go through with this. Is there a better success rate long term with the sleeve surgery versus the gastric bypass surgery? Is that something that is even interchangeable with these? And I know you said in El Paso there is more of a gastric bypass than other parts of the country, which makes perfect sense. But just in general,
Long term, they both kind of end up at the same point.
Okay.
It's in between there that you can see more of a fallout on patients with sleeve. Because if you noticed in the picture, beyond the distal portion of the stomach, they keep their normal anatomy. So really, like I said before, you're only working on the amount they can. So when you're doing that, now the patient still has the freedom to make the wrong choices once everything heals. So a donut, something high in sugar, something high in carbs is perhaps, once they heal the sleeve, is not going to make them as sick and send them the negative feedback that a bypass will.
Right.
Because the bypass,
Okay.
it's a very small portion with a piece of intestine hooked up to it. And if they eat that donut, they eat that carb, it's going to plop into the small bowel, and that'll send a negative signal to them saying, hey, you ate something wrong. They start sweating, they get diaphoretic, they get nauseous, they're dry heaving. So
Right.
that type of feedback in some patients will keep them on the right track longer.
Right.
So that's the only difference. Now, if you have a very disciplined patient who says, you know what, if I see that I'm losing weight and I'm healthier, I just need that little help,
Yeah.
then yeah, the sleeve is going to be fine. But if you have a patient who tells you, and I appreciate the honesty of the patients, because some say like, oh no, I know my willpower. It's
Exactly.
zero.
Right.
And I need all the help I can get. Which one's for me? Bypass.
And again, it's all about throwing it out there and being honest. I'm going to stop the questions from the audience for just a second. I'm going to give some information out, and then I'm going to ask you all just to talk about what you wanted to talk about as you were driving over here. So in the meantime, again, there is a new COVID vaccine website and a telephone number. I just want to make sure that we get that out there. When the vaccine is available for you to take it, this is the El Paso County Medical Society and the El Paso Physician asking you, do take the vaccine. It's good for you, it's good for everybody around you, and it will get everybody back on track. But the address for, the email address, not the email address, the website address, EP, just think of El Paso, EP COVIDvaccine.com, not org, but epcovidvaccine.com. For a telephone number, 915-212-6843. It's on your screen, but again, 915-212-6843. Just in case you missed it, we are streaming live on YouTube. You can find PBS El Paso and the El Paso Physician on YouTube. You can also find the show again on PBS El Paso. Just go to watch. And then also at the El Paso County Medical Society website, and you'll be able to find it there, epcms.com. So I know sometimes we go so fast that it just, boom, all that information gets there. So Becky, on your way over here, or since they said, hey, Becky, you got to be on TV Thursday night, and you're like, oh my God, what do I say? So now's the time to say it. What is it that you would like to get across to the audience that we either may not have spoken about yet, or something you'd like to re-emphasize that we have spoken about?
Okay, so well, I think we pretty much talked about everything that's super important, but just to let the audience know, just to make them comfortable, we are offering Zoom appointments. So our seminars, first of all, are via Zoom right now.
And we haven't talked about your seminars. This would be a great time to do that.
Right, so we are holding them Zoom. You just call our office, 915-832-2485, and we can register you for those seminars, or you can go to the Providence website and register there.
Okay.
And then
What is the Providence website?
it's
I think it's the Hospitals of Providence.
the
right?
Hospitals of Providence.
Okay.
Yes.
.com.
And then you choose the bariatric, and then you can register there.
Okay.
And also, once we schedule you for that appointment, Dr. Lara is seeing the patients via Zoom as well,
Okay.
just to keep that, patients safe and for them not to feel overwhelmed having to go out to a clinic for an appointment.
Right. Excellent. Dr. Lara, again, I know we've got maybe 7 minutes left or so, so whatever it is that you want to get out, and 7 minutes is actually a really long time. I'm sorry?
You don't have another question?
I do have another question, actually. So, well, I'll do that. So it says to Dr. Lara. Remember in the old days, I'd show you the piece of paper. It says to Dr. Lara. So it says to Dr. Lara, I have HBP, obesity, high cholesterol. Which other medical clearances from which doctors do I need in order to qualify for the bariatric surgery? Now, that's kind of a question for both of you, but that is a very specific question from the audience.
So initially, just come see us or log on, get on the Zoom, and just know your doctor's names. And that's step number
Very
one.
important,
Because a lot
right.
of times I'll be like, well, I saw a cardiologist. Well, what's his name? I don't know. But if you just come by, if you just have all your doctors, your PCP's name and whatever specialist you have their name, we will generate a letter during the initial encounter with that doctor's name. And by now, you know, all the doctors and specialists in El Paso are familiar with bariatric surgery. And we just generate that letter, give it to the patient via email or fax, whatever their choice is, and then they take it to their specialist. And in that letter, we specifically state what we need in order for that patient to get cleared for surgery preoperatively. So beforehand, don't worry about it. Just come to us, know your medical history, know your specialist names.
Okay, so going back to coming to us, what is the telephone number to the clinic? Do you have that on top of your? I should have asked you
Yeah,
the first
no,
show.
it's 915-832-2485.
And when somebody calls that phone number, what do they expect?
They expect for me to answer.
Becky will be answering the
I'll
phone.
be
If you think
answering your
she's kind of
phone.
cute, just saying. Okay, so Becky's going to be answering the phone. And what are some of the very common, like most common questions straight out of the mouth on a very first phone call?
How do they start the process?
Okay.
And if their insurance covers, more importantly. So yes, you will be guided on how to start the process, and how to start the process is attending a seminar.
Okay.
Okay, at the seminar, you'll learn everything about the surgeries, and then right there, we can continue with an appointment. At that time, we get your insurance information as well, and we verify, make sure that it's a covered benefit. If not, follow the other options that are
And
available.
when are your seminars?
The reason the seminar
Yes.
is so important is because you keep hearing us harp on seminars are why?
Right.
Because it's education.
Right, they
So
need to
if
know
the
what's
patient
going to be
knows what
going
they're
on.
getting themselves into.
Right.
That's step number one, because you're right. They could think, I'm going to go to these guys and they're going to do lipo on me, or they're going to prescribe some magic diet pill. This is a surgical weight loss center. So that's why step number one, start educating the patient.
Man, I would love for you. You said diet pill, and it's January, and it's on every. Try this diet pill. Talk about diet pills just in general.
Okay, I have nothing against them. They work, but there's side effects to them. You know, and what is
a diet pill? What's it doing to you physiologically?
Increasing your metabolism in an artificial way, yeah. So sometimes you feel like your heart's going to jump out of your chest, or you're up in the middle of the night, you know, like a maniac.
Yeah, they scare the heck out of me.
Right.
I mean, you hear it, and then it's like, oh, and then you might die, you know, with all the stuff they put behind there.
So that's a problem with it. The side effects, the fact that the effect of it is transient, and then it can be expensive, or just getting the renewal, you know, the new prescription. So that's why.
So the idea is that they're trying to
temporary fix.
Okay, and the idea is that it's trying to change your metabolism, increase your metabolism. But again, there's only so long it's going to work, because again, behavioral change, and that's what's so.
Or your body gets smart.
Or your body gets. I'm sorry.
Smart.
Or your body gets smart and starts.
The
out
effects are
testing
not
it.
it's not as effective.
Question here from the audience, and I want to respect it because we're about to run out of time, but is AIDS a factor in whether or not you can be approved for bariatric surgery? Again, a very specific question from the audience. I wanted to honor that.
No.
Is that not a factor at all? So that's it from there. So what I'm going to do, Dr. Lada, is there anything that you wanted to bring up? We have a whopping 3 minutes that we haven't talked about yet.
Number one, get vaccinated.
Yes.
I got
Should I throw
vaccinated.
this?
All I had was a sore arm. And patients of mine, both coming into this and after, post-op patients have been vaccinated, fine.
So I'm going to ask you as the doctor on the air. So I'm trying to sign myself up, but here I am. I'm 53 years old. I'm healthy. I'm trying to sign up, but it's like, no, too bad. You're in the last of the last of the last groups. How do we get people not to lose their patience in waiting for their turn? You know, and again, I will say epcovidvaccine.com. Sign yourself up if you can. Also, El Paso Strong, you're in a different situation because you're a doc. Have you been able to get vaccinated?
Yes.
Okay. So just talk about the normal person out there that doesn't have any, the under 65 issues, etc.
Yeah, like I said, just understand that I can see behind the scenes that they're doing everything possible to
Yeah.
get these vaccines. And so it's not like somebody's hoarding something or something like that. And
Yeah.
the process here in El Paso is actually very streamlined.
Right.
It is good.
Yes.
But unfortunately, there's just not the vaccine available.
I have to give a shout out to Nico Tejada, who's on, I guess, before the holidays, and he was talking about the rollout, and it was super impressive. So El Paso is actually doing very,
It
very
is.
well
Right.
compared to the rest of the
Percentage-wise
state.
to Houston, Dallas,
Yes.
we've done very well.
Yeah.
But there's just no more vaccines.
So El Paso needs a bit of a pat on the back to all our first line workers, on everybody who is disseminating the vaccine. It is just the supply that's not getting to us. But we are, when I say we, El Paso is in a better situation than most of the country when it comes to that. So Hospitals of Providence has been really good about that. Again, I want you to go to elpasostrong.org, epstrong.org or elpasostrong.org, sorry, that's the one that's spelled out. And then also this website, which is epcovidvaccine.com. Yes, this is where the patients come in. You might have to go back. You might have to refresh your screen, go back over and over and over again, but it matters. The telephone number is 212-6843. Ryan, you were a rock star today. Thank you so much. Ryan Fonseca, who is a first-year medical student who's been helping out with getting all of our questions this way. I want to say thank you again very much to Patsy Slaughter at the El Paso County Medical Society and also Elsa Shapiro, because they make sure that I've got the right information before we hit the show on what the most up-to-date information is on what's happening with COVID here in El Paso. And again, to check your BMI, just go to any search engine, BMI, and you can calculate your weight at that point. I appreciate very much you guys watching the El Paso Physician. We've got a program again next week, and it's going to be all about eye issues that are affected because of COVID-19. So again, we're trying to keep on that theme. We appreciate you watching. This has been the El Paso Physician. I'm Catherine Berg, and good night.